Magnesium is very important in formation and breakdown of ATP. Now, those people are constantly saying, you know what, I have to eat carbohydrates to get energy. When you eat a carbohydrate, you break it down to glucose, and that glucose has to go into several steps to actually yield ATP, which is the energy currency for the cells. Those steps are what we call the glycolysis. Okay, so glycolysis is breaking down glucose to get energy and all that. So those steps that are involved in this glycolysis process, there are about 20 steps. Those of you who have gone to medical classes and all that, you know of the 20 steps of glycolysis. Those steps, what happens is magnesium must be involved in formation of ATP, and then after you form this ATP, for you to break it down, you must use magnesium. So anytime you are feeling this low energy, just know magnesium, you might be having magnesium deficiency. Anytime you're having these symptoms of anxiety and palpitations, weak bones and bad dental formulas, now start associating that. Start thinking about magnesium. Go and check magnesium levels. ATP being the energy source of the system, adenosine triphosphate. So when you can't use glucose as energy. You break down glucose to release something that is actually going to be used by the cells as energy. That's what we call the ATP. And then magnesium plays an important role in what? In muscle relaxation. There's a condition called tetany. Tetany is a condition that is caused by tetanus, the tetanus toxoid, where you have your muscle contracting so fast. Muscles contract continuously and you cannot control them. That is influx of calcium all through. So what do? Give magnesium sulfate or give magnesium supplements. For those guys who have twitching of the eyes all the time and they are non-stop, you can't help them. Magnesium comes in handy because it causes relaxation of these muscles. So actually magnesium is a muscle relaxant. You can simply eat avocados and nuts to get the supplement that you need. You can do a magnesium supplement to actually make sure that your system wakes up from those contractions that can actually mess you up. As magnesium causes relaxation of these muscles, one challenge comes in. When you're taking those antacid suspensions and all that have magnesium, magnesium causes diarrhea. So magnesium salts cause diarrhea. Magnesium salts cause diarrhea. Calcium salts cause constipation. Do you see again where they go left and right? So this one is causing diarrhea, the other one can actually cause constipation. So when you take in those supplements for magnesium, chances are one of the side effects will be a serious diarrhea. Oh, you will diarrhea yourself all the time and they will not tell you. And when you diarrhea, you are losing out on sodium and you're losing out on the potassium sometimes. But vomiting is the one that actually is responsible for potassium, a high amount of potassium loss. But diarrheaing, you're losing chloride, you're losing water and getting dehydrated and you're losing sodium. So magnesium can actually again cause sodium deficiency when you're actually getting into the diarrheaing stage. So yes, this one is a very good element, but it has a lot of challenges in terms of taking the supplements. That's why it is easier if you simply eat foods that are rich in magnesium, because the body knows what to do with this magnesium. Excess of it will be taken out, rather than go for the supplements, thinking that these supplements are going to change your status in terms of hypertension, and yet they are going to actually bring you so many problems later on. So be cautious. Do not be so fast to just jump into supplements because somebody was marketing them to you, because somebody just used them and they improved their sleep. Do not be fast to jump into them, okay? Always analyze your system. When you have a real deficiency that needs to be addressed by the supplements, now we can actually head that direction of supplements as you fix your kitchen and your gut. As you fix your kitchen and your gut. I insist that, because that's where the problems are coming in. Good. So where are the sources of magnesium? Let me read some of the sources of magnesium. One, of course, green leafy vegetables. Also cruciferous vegetables, the broccoli, the cauliflower, the lettuce, the cucumbers, and all that. We have meats, all types of meats. We have poultry plus the skin. We have beans, our complex carbohydrate. We have sweet potatoes. We have almonds, avocados, and all that. Imagine the food that we actually advocate for, the food that still have the magnesium. Why don't we just follow that direction? Imagine, guys, when I tell you to just eat healthy, I really pity these guys who keep on arguing in my comment section. I really pity them. Why? Because they don't know what we are talking about. They are not here on this live. Of course, they will not be here. They don't care. But they will come and put that negative energy in the system. The reality is, if you just start eating healthy, you will not struggle to do anything. You let your body do this. Understand that the body ni kama fundi. It's like a mason. When he tells you to give them cement, please bring cement. If he tells you to bring 5 bags of cement, don't start saying, oh, we are anataka kunibia. This one wants to steal cement from me. This one wants to just exploit money from me. At least let them exploit money from you, but let them be responsible for building the wall so that if it collapses, you can hold them accountable. That's the same way the body operates. So if the body is asking you for nutrients and minerals, give it nutrients and minerals. It will use that as raw materials to rebuild. Our problem is the body is asking for minerals. We keep on giving it crap. We keep on giving it things that don't have any nutritional benefit. So your body is constantly asking, please give me amino acids through eating red meat. Your system tells you, do not give the body red meat. Red meat causes cancer. But eat sausages. The system is saying, please, sir, give me magnesium by eating avocados. They tell you, oh, you know what? Avocados will make you fat because they have fat. The system is telling you, please, give me zinc through eating these pumpkin seeds. The system tells you, no, pumpkin is going to cause you a lot of problems. Actually, do not eat pumpkins, but go and buy, I don't know, pumpkin flour. I'm like, go and buy flour that is fortified with zinc. But why would you take zinc out of this pumpkin and then make the flour and then fortify it? The best source of the best way to take magnesium is actually taking it through organic foods, because if you take the supplements, diarrhea is coming in because of the relaxation of the smooth muscles that line the gut wall, and diarrhea is coming in. And if you're taking it as an antacid, which most of us do without knowing, more problems, because antacid will neutralize the stomach acid, therefore you will not even liberate magnesium from foods. Okay, good. And then magnesium is excreted through stool, through urine. That means the kidneys and the liver are very important for you to excrete magnesium efficiently. Bure utaingia shida. But alcoholics, the tremors that are present in people who are alcoholics, one, they have vitamin B1 deficiency, the thiamine, right? We talked about thiamine. But if these people, when they get to hospitals and they're being managed with thiamine injections, the vitamin B complex injections, but the symptoms are not going out or they're not going away, the best thing to do is to give them magnesium, because magnesium is the one that is responsible for those tremors in those people who are alcoholics, specifically alcoholics. Why? Because alcohol depletes magnesium so badly. A lot of alcoholics, actually 92 to 95% of alcoholics are suffering low magnesium levels in their system. That's why they end up being very emaciated, they lack appetite, they have very weak bones, and they have very bad teeth. You know those people? They have a lot of problems, and now they have kidney problems. And then, of course, hypertension is coming in because, you know, well, what alcohol does to the blood vessels. So that is magnesium for you. However, I want you to see this, that there are two categories. We have hyper and hypo. So when you have high magnesium, that is hyper. When you have low magnesium in blood, that is hypo. So I want you to see this. Put this side hyper, this side hypo. What are the causes of hypermagnesemia? When you say magnesemia, it just means magnesium in blood. What is the cause of hypermagnesium in blood? Number one is antacids. The use of those antacids that have magnesium, the one that you chew and the syrup. When you take them, you're taking in magnesium, gets into the blood, high magnesium levels, low calcium levels. Number two, kidney failure. Why? Because kidneys are the ones that excrete magnesium from the system. Number three, the thyroid problem, hypothyroidism. When you have hypothyroidism, you end up having low magnesium because the thyroid plays a very important role in absorption of magnesium. That is for the hyper, how you get higher magnesium into the system. Now, hypo, diabetes is number one. So if you have diabetes, chances of you getting into low magnesium levels, ziko juu. Number two, drugs. Which drugs? Antibiotics. Constant intake of antibiotics. Unaanza kumeza antibiotics from the time you're a child. You are messing up your magnesium levels because antibiotics help in excretion of magnesium. So you get into hypo. But most importantly, diuretics. Diuretics are drugs that are used in high blood pressure. Listen. Magnesium deficiency can actually exacerbate hypertension, right? So when you have low magnesium levels, your blood vessels are taking in calcium, they are constricting, blood pressure is going up, hypertension. Low magnesium, hypertension. You can use magnesium to reverse hypertension. But now, you're here taking drugs for the same hypertension that release water from the system or fluids from the system. They are called diuretics. They release water from the system. You urinate a lot of water. These drugs called diuretics are actually causing excretion of magnesium, very quick excretion of magnesium. You will not find time to reabsorb it. When you excrete magnesium, you're going into hypomagnesemia. that is going to bring you more hypertension. So drugs for hypertension can actually cause hypertension as a side effect. Imagine that. So you're eating bad foods that cause you hypertension, and now you're continuously eating the same foods, and now you're taking diuretics, drugs for symptoms of hypertension. You're excreting out magnesium. You're going into more hypertension as a side effect of the same drugs. Are we solving anything? That's why I tell you every time that no human is designed to be on drugs for a lifetime. Now, people are asking, what are these diuretics? One is thiazide diuretics, hydrochlorothiazide. You people call it HCTZ. Number two, loop diuretics like furosemide. You people call it Lasix. Another one is called potassium sparing diuretics. Potassium sparing, that is what we call what? Spironolactone. You people call it aldactone. These are drugs that actually ease up on magnesium in the system and cause you more problems. So be very cautious when you're on those drugs. If you're on those drugs, please increase your dietary intake of magnesium through the foods that we just said, or you can actually go on a supplement. Oh, now you know. Another one, chemotherapy. Hey, chemotherapeutic drugs, cancer treatment drugs. And the most important one, the largest one that actually causes you total depletion of magnesium is called cisplatin. Cisplatin is an anti-cancer drug, is a chemotherapeutic drug, causes you low magnesium levels. And then antibiotics like gentamicin. I know most of you are constant injectors of gentamicin. Oh, you know what? I have brucellosis. These drugs that are in that category of gentamicin, they actually cause problems with the ears because they destroy the nerve that supplies the ears. That's why one of the side effects, immediately you start injecting it, you start hearing this noise in your ears, the ringing voice in your ears. Also, they are very good at destroying your kidneys. Gentamicin is very good at destroying your kidneys. So those, as you constantly go to hospital and tell the doctor, you know what, hii brucellosis yangu nataka tu gentamicin injection, and you inject it for 21 days. Oh, problems. Because it's toxic to the ear, toxic to the kidneys, and now again causes low magnesium levels. Yeah. And then other things that can actually cause problems with the low magnesium levels, bariatric procedures like gastric bypass, like the gastric balloons and all that, weight loss procedures, they are going to cause you this problem. And then constant consumption of proton pump inhibitors, omeprazole, esomeprazole, pantoprazole, all those drugs, as you continuously take them for your gastritis and your acidity, you end up getting magnesium deficiency. That is a problem. I have already talked to you about the use of magnesium in pregnancy. Because one, magnesium is coming in to support the bone density. Two, the magnesium is coming in to actually ease up on increasing levels of blood pressure as a result of fluid retention. And most pregnant women have insulin resistance. So they are consuming these carbohydrates constantly and the sugars because of the cravings, because of estrogen levels that are going up. They end up retaining a lot of water, and that increases blood pressure, and now they have problems. And high blood pressure in pregnancy, which you call preeclampsia, can actually cause a lot of convulsions, can cause termination of that pregnancy, can actually destroy your fetus. So a lot of it is a problem. So wewe jua tu, as much as you're taking those sugars in that pregnancy, even before the pregnancy, you're actually exposing yourself to getting hypertension later, and now you'll need magnesium sulfate for pre-eclampsia. You've seen ladies getting the magnesium sulfate injection during the hypertension in pregnancy is actually coming in to actually ease up on the blood pressure and prevent those convulsions. It's a good one in this one.